coming up next on the Holistic Wealth Podcast.
But the main thing you want to do is you want to make sure that when you're looking at some of these remedies, that they don't have phenylephrine in them if you're trying to manage some of these sinus symptoms. Because once again, it just doesn't work. And then I have other patients who have blood pressure issues as well. Once again, not a great combination. So it's one of those things that I mentioned before, educating ourselves about what we're putting in our bodies and making sure that combination thing isn't there in the medication as well.
You're listening to the Holistic Wealth Podcast with host Keisha Blair, author of Holistic Wealth and founder of the Institute on Holistic Wealth. And now, here's your host, Keisha Blair.
Welcome to the Holistic Wealth Podcast. Again, we have Dr. Redcross on the show. He's sharing wellness tips with us. And this week, we're focusing on sinusitis prevention and treatment. And we're so happy to have his expertise on the show because, as you all know, health is a critical pillar of holistic wealth. So it's amazing that we can have him as a guest. And we're talking about the sinuses this time. Yeah. So important. I'm a sufferer. Several family members are. I'm sure all of us listening in can identify at least one person who we know that suffers from this issue. So Dr. Redcross, thank you so much again for sharing with us. And just to start, just the basics here, because I know a lot of us talk about sinuses. We talk about how we feel. What are the sinuses? Where are they? And what do they do?
So this is what I could kind of put on my nerd hat here because I love the science, right? And the science are the sinuses are fabulous, everyone. We have 4 sets. We have the frontal sinuses, the maxillary sinuses. We have the sphenoid and ethmoid. The point is, these are long words, but these are little cavities that by God's good design are there to help relieve pressure, like we feel sometimes when they're blocked up. And also to make our heads lighter as far as throughout evolution and so forth. So the point is that they almost act as a buffer for all the things that we inhale and snip and that sort of thing. So they're very important because as we're talking about today, we all know how it feels, or several of us knows how it feels when they're blocked up and why they're blocked up and things of that nature. So they're very important in our evolution as people. But they're very important to make sure that we keep them as clear as possible, too.
Yeah, no, for sure. And, you know, it's so funny because when we talk about the sinuses, we don't often talk about what causes the problems. So I'd love to get from you kind of what are the root causes of these sinus problems that we face every day.
So from now on, everyone, when we're dealing with our sinuses, I want you to think of 2 things, almost like a fork in the road, right? It's going to either usually be allergic or infectious. If it's allergic, it's a little bit of what we have talked about before on another episode when we talk about the allergies with the sneezing, sniffling nose, running, itchy throat, that sort of thing. That's that allergy wing. When we come on this side with infection, it's going to be either viral or bacterial, very rarely fungal. Fungal's a different discussion and a lot more serious. The point is, it's typically viral, everyone. So for that side, an antibiotic is usually not necessary, even though I know a lot of us ask for that. But usually the reason is it's either allergic or it's either an infection. And so that's when you need to go into the doctor at some point to kind of figure those things out. But once again, when you're looking at something that's infectious, it tends to be that discharge, discoloration, yellowish, greenish, that sort of thing, to really make sure that you get seen by the doctor to see what's going on there.
Yeah, no, for sure. And I know for some of our audience members, they wanted to know the difference between chronic and acute, and you probably touched on a bit on that, but can you just differentiate for us the difference?
Oh, yes. Thank you for asking that. So acute, everyone, is usually within 30 days. So if something is within that 30-day window, it's usually acute. If it becomes a little bit further than 30 days, especially to 60 days, that's what we call chronic. That becomes a really big issue when you're talking about something like a potential sinusitis, different regimen to treat it and that sort of thing. But yeah, it's important. That's why, when I mention things that I like to think about that are closer to the earth, I'm usually trying to get to that acute phase, everyone. So that right when your symptoms start, we can kind of jump on it.
Amazing. And so when we talk about those closer to the earth remedies, are there any natural remedies as well as lifestyle changes that can help alleviate sinus congestion and pressure?
Well, sure. So this is the fascinating thing when we talk about sinuses. So yes, there are some remedies that is helpful, but you guys always know when I come on, I say food is medicine because it really and truly is. So when you think about some things to avoid, that becomes things like alcohol, certain spices, nuts, legumes like peanuts, that sort of thing. On the flip side, there are some things diet-wise that can make a really big difference. Onions, peppers, some of those things can help do just the opposite, improve things. So when you're thinking about something, you can look in the cupboard, make sure you have a little bit of that around in your cupboard anyway, as far as food. On the other side of things, as far as remedies, once again, when we talk about homeopathy, everyone, we're talking about that acute phase, right? Before it gets to that significant point when the symptoms first start. One of the things I love is boron sinus calm. The reason why is because mostly when we're dealing with sinuses, the three things that we typically see can be some nasal congestion, sinus pressure, and also that sinus headache. And sinus calm works with those symptoms, allows your body to work with those symptoms. And so those are the things that I always talk about, the food and especially sinus calm, to say, how can we kind of put our arms around this, everyone, and also making sure that we're supporting the symptoms and making sure that we're eating the right things to even help a little bit more and avoiding the things that we shouldn't be taking.
Yeah, no, absolutely. And so I know a lot of people are thinking, because I know this happens to me all the time. I feel symptoms coming on, and I don't know whether it's the common cold, the flu, or sinusitis. Like I feel this stuff, like I have postnasal drip, and I'm like, well, I know because I feel that, like that draining. But how can people really know which, like between, the common cold and sinusitis, how can they know which one is which?
All right. So I'll say this, and I'll even add the flu, like you said. So everyone, when you're thinking of the flu, think neck down, body aches, feel like you've gotten hit by a truck. You feel like, I just cannot get out of bed. So that can eliminate the flu. When you're thinking about the common cold, let's think neck up. That's when we're talking about runny nose. Sometimes with allergies, some of the sneezing and that sort of thing. When you're thinking about a sinusitis versus the other two, I want you to think more pain, right? Usually you get that pain, that sinus pain. Your ears are kind of stuffed up. Your sinuses are hurting here, especially if sometimes patients will say their teeth hurt, that sort of thing. Just some of these things that you don't think about, but it clues me into like, okay, we're dealing with a little bit more. I mentioned before about the color of the mucus. I should explain one quick thing. So the color of the mucus, everyone, doesn't necessarily say that it's bacterial or viral or what have you, meaning an antibiotic is necessary. It's usually the age of the mucus. But the point is, with the sinusitis, the discoloration, some of your symptoms you're having, and a fever, that typically helps us to rule in sinusitis and how that needs to be managed out of those three of the flu, the cold, and sinusitis.
And so when, we're looking out for remedies to treat the sinus congestion, are there any ingredients that we should look out for that we want to avoid? I know there's some with some very complicated names and we can't even pronounce them, but if you could just shed light a bit on what we should avoid in terms of these remedies that we see. We mentioned in the last episode about these over-the-counter remedies. There's such an array of them. Like, are there any ingredients that we should be avoiding, especially when we're thinking about, remedies for sinusitis?
No, absolutely. One, and kind of one of the ones that can sound complicated, but we'll learn all together today, is phenylephrine. It's funny. You guys have heard probably on the news, the phenylephrine used to be, once again, a combination, like we mentioned before, Keisha, right? It was in a combination sort of medication. We found out it doesn't work. It doesn't work for this. So you want to get things that are phenylephrine free. That's another reason why I like the boron sinus calm. It doesn't have that in there. I don't have to walk that back in a sense to say really what's going on. Oh, and I should also say with the sinus calm, you should be 6 years of age and older. It's important that, to know before we give our children things. Sometimes it's weight-based, but I think it's important to kind of know, obviously, the month-based, depending on what you're doing. A lot of homeopathic meds and herbs and things of that nature are usually more age-specific than weight-specific. But the main thing you want to do is you want to make sure that when you're looking at some of these remedies, that they don't have phenylephrine in them if you're trying to manage some of these sinus symptoms. Because once again, it just doesn't work. And then I have other patients who have blood pressure issues as well. Once again, not a great combination. So it's one of those things that I mentioned before, educating ourselves about what we're putting in our bodies and making sure that combination thing isn't there in the medication as well.
Yeah, no, absolutely, for sure. And I have a quick audience question for you about sinusitis.
Yeah.
One of our listeners has it, very bad. And he's just asking about the drainage to the back of the throat. He can't seem to clear that mucus there. It just seems like it's chronic, not going away. despite trying a lot of different techniques, and including that sinus. I think it's that wash, the drain, the thing.
Yeah.
I don't remember what it's called, but he's just asked that I pass on that question to you. So is there anything else he can do if it's just not, he just can't seem to break the drainage to the back of the throat and the buildup?
Exactly. And so let that caller know that's postnasal drip, very common when you're dealing with allergies or also with sinus issues and challenges. So humidifiers are very important. Making sure you're taking care of some of those things that we control, like molds on the shower curtain. Making sure that we're washing carpets, being really careful if we have pets, as far as pet dander, some of those things that are really important. Even that neti pot you mentioned where you pour it in your nose, it's
Right.
effective, okay? So something to really think about. So that's why I mentioned before when I mentioned that sinus calm and you talk about that nasal congestion and that drip, we want to cut off that faucet, everyone. Now, for the caller as well, if it becomes chronic, meaning like over these next few days sort of thing, I need to make sure that you see your doctor because at certain points, especially if you're having that teeth pain that we talked about, that can sometimes clue us into, we need a little bit more here. We may, in that case, have to use our prescription pad to make things a little bit better.
Okay. No, that's great to know. And so is there anything else? I know we mentioned in the last episode when we were talking about seasonal allergies, when to absolutely go in to see the doctor. I know you touched on that just now with that last question. Is there anything else that we should look out for as a signal that we should definitely go in when, the symptoms start getting worse?
I usually tell patients that first 48-hour window, the first thing is I know we're all busy, we're running around, but you have to jump on your symptoms right when they start. That's where homeopathy, for instance, that I've mentioned, does its magic. And really most of what we do in medicine, it's that prevention thing. I wouldn't say that that's preventative, that's more symptomatic treatment. But my point is, we have to kind of dial back and focus on ourselves first and our health and the wealth that you're talking about and making sure that we're staying on top of that, especially early. I mentioned some of the things such as making sure you're vacuuming, making sure you're taking care of pet dander, making sure you're doing some of the things that we can take care of in our environment, right? Because that's what we can also control.
Yeah, no, absolutely. And these are great tips. And once again, very educational. Thank you so much, Dr. Redcross, for sharing this wealth of knowledge with us for this wellness series. We so appreciate you being here. Is there anything else before we go that you want, just so that we're covering off everything that you had in mind? Was there anything else that you wanted to share before we close off?
Well, I just wanted to make sure that, during this time of year, everyone, this is a beautiful time for us to get out and enjoy this thing that we call life. And the key here is that there are some things that are over the counter that we're talking about that are closer to the earth that can bring healing and support as well. So I just want to make sure everyone is mindful and also mindful of the things that we can do to also make sure that we have a good time during this time of year.
Absolutely. Wise words. And thank you so much for that reminder. Once again, thank you so much for joining us. We know your time is absolutely valuable, so we are happy that you took the time to join us on the podcast once again. So thank you so much for that, Dr. Redcross, and we're looking forward to having you back again and again on the show to share those expert tips.
Oh, me too. Thank you. Take care. Be well, everyone.
The Holistic Wealth Podcast with Keisha Blair is brought to you by...
Have you joined the Institute on Holistic Wealth? If you haven't already, what are you waiting for? Choose your membership plan at the Institute on Holistic Wealth/memberships to join. As a member, you'll get access to free worksheets, advice, coaching, and an intentional design workshop. As you start to live a more holistically wealthy lifestyle, you'll want to stay for a very long time. So go to Institute on Holistic Wealth/memberships to join. If you haven't read the book yet, pick up a copy of the award-winning best-selling Holistic Wealth 36 Life Lessons to help you recover from disruption, find your life purpose, and achieve financial freedom.